especially he is in Apollo Hospital looking after the critical care services. And thereafter, in the afternoon, he goes and checks up on patients and how they sleep. So let me give you a bit of a background of Dr. Ramakrishnan. He's an American board certified specialist in internal medicine, critical care medicine, and sleep medicine. He has a master's degree in medical management from University of Southern California. Before that, he graduated from Stanley Medical College from our own Chennai, worked in the UK and USA for over 13 years, and came back to India as he was keen on making a difference here. Now, one of the things he's been doing here is developing the critical care specialty. So there is something called the Chennai Critical Care Consultants, ICUconsultants.com, a private practice group of critical care specialists. They also do a lot of specialized innovative ICU services. They've also successfully established the TACT Academy for Clinical Training, which is India's first simulation-based healthcare training center and has won awards for the innovative concept in healthcare education. They've also been listed for this distinction in the Limca Book of Records. By the way, he's the first board certified sleep specialist in India. So a lot of you who are having trouble with respect to sleep, especially during these times, we'll hear more from him. And being a good entrepreneur doctor, he established the Nitra Institute of Sleep Sciences in 2004. It's the first institution to offer a postdoctoral fellowship in sleep medicine and is affiliated to the Tamil Nadu Dr. MGR Medical University. He is currently the Vice Chancellor of the Indian College of Critical Care Medicine. He was a past president of the Indian Sleep Disorders Association. He has been honored with a fellowship by the American College of Physicians, American College of Chest Physicians, American College of Critical Care Medicine, Indian College of Critical Care Medicine, and Indian Sleep Disorders Association. Today, we are kind of dividing the talk with him in 3 segments. The first is, of course, on critical care and really what happens in an ICU. And here I must mention to you that Dr. Ramakrishnan has written 2 books. One of them is called ICU Ulla Nadupadu Enna. And the other one he's written is on sleep. Thookam Prachnegal Thirvugal. Now, we are first going to talk about the ICU bit. So, Dr. Ramakrishnan, welcome to you and this busy afternoon for you. I know that you are busy as a doctor, but I think a lot of us perhaps still don't understand the gravity of what it is to be in an ICU and what's happening in critical care. I just want you to walk us through what a typical today's situation in an ICU looks like and what's so grim about it.
Sure. First of all, thank you for having me here. When Akila mentioned to me that she wanted me to do an AMA session, I found it interesting because in the medical world, AMA stands for Against Medical Advice. People leaving hospital, when we tell them not to do it, we call it AMA or Against Medical Advice. So I found that kind of interesting that that's what this is called. So please follow what I'm saying. It is, and don't do anything against medical advice. That's what I wanted to start with. Today in the ICU, and a lot of you are probably hearing that, hospitals are saying they don't have beds, while in fact that, the hospitals are empty. And why are private hospitals refusing patients? Why do they not have beds? So several questions amongst the general public. So let me first start with that. For example, let's say you have a 500 to 600 bed facility, like the one that I'm working in Apollo Hospital. What is happening right now is that in general, all the non-emergencies, like whether it is an elective surgery, like people coming into the outpatient department, has all come down drastically. So no longer, and I would feel free to say this, people used to say when they come into the Apollo Hospital's lobby, it feels like a railway station. They say that, oh God, it's so busy, like we're not even able to come in there. Today, you wouldn't find it like that. When you come in, the lobby might look completely empty. Okay, people who had trouble complaining of no parking would now find that there's a lot of parking. But then they wonder, why do we not have beds? To answer that question, broadly today, when we look at admissions, we have those who are admitting with emergencies related to COVID disease, and those who are getting admitted related to non-COVID emergencies. As I said, the elective procedures have all come down. So it's broadly COVID and non-COVID emergencies that are coming in. And the COVID emergencies seem to be filling our units. We have expanded the number of beds, and like, it is not easy. It is not just like converting any room into a COVID room, because we need to have the appropriate facilities for purifying the air, having negative pressure. All of those needs to be done, and those units are specifically accommodating the COVID patients. We also have an ICU where we try to avoid patients who have COVID and have just the non-COVID emergencies. But having said that, we have been in for some surprises. When we just admitted somebody, I'm just giving a very remote example, with a heart attack, and then they also say that, oh, I have a cough, and then you check and they could have COVID. So while I say that we try to segregate them as COVID intensive care unit or COVID emergencies and non-COVID emergencies, there is a possibility that there could be a little bit of a mix that could happen, particularly when the symptoms are unclear in the beginning. So when we walk into the ICU today, I would assume every patient has COVID, so, and therefore we need to appropriately use personal protective equipment and then go in to see the patients. So every time I walk in, I have to wear a personal protective equipment. Again, when we're walking into the COVID ward where we know it is positive, we wear this first. The procedure is called donning. So it's quite a significant thing. Depending on whether we are going to manage patients on ventilator, we might put a full suit. Or for those who are managing patients who are not on a ventilator, they may be using a mask, gown, face shield, and all of those, all adequate to ensure that there is no transmission of the droplets or the virus. So we go in, and guess what? Most of our patients, forget patients, most of our own colleagues, nurses, cannot recognize us because we are often fully suited. So they don't even know who is at the other end. We'll have to introduce ourselves and start what we are doing. And once we go in and we are donned with all these personal protective equipment, we may be there for several hours sweating inside, but we'll have to finish our rounds or whatever we need to do inside. If we need to take a bio break, we need to doff, which is basically, there is a process, there is a protocol on how we remove all the personal protective equipment in a dedicated space, because that has to be disposed appropriately, and then come out of the unit. And after I come out, if I get called in for any reason, yes, we have attempted to do some video monitoring so that you don't have to go in for everything. If there are questions asked, if we could clarify to the nurses or the junior doctors who are inside. But if I have to go in, I have to go through the whole process again of donning a new personal protective equipment. So in summary, the ICUs are a very different place now, because often, as I said, we have to be using these personal protective equipments. It is not easy. It is extremely uncomfortable to be inside those personal protective equipment for hours together. Like our doctors, when they come out, I call them my, sweat boys and sweat girls, because they're extremely sweaty coming out, like often wanting to have another shower, change again, go back inside. It's very, very challenging. But as much as people won't like to hear this term, I think it's an absolutely fascinating disease. Every day we are learning new things. We thought we knew how to manage a viral illness, a viral respiratory failure, somebody on a ventilator, but we are being proved wrong every day.
Okay, you talked about this viral infection being quite different. What are the travails of the healthcare professionals in managing this particular viral infection? Apart from the PPE, which is a big challenge, you also had issues with the sanitizer, and we are seeing terrible photos of healthcare professionals' fingers looking like some aliens' limbs and all that. So what really is happening with the viral infection, and B, what's the impact on the health and the well-being of the healthcare professional itself?
Okay. First, let me start with your question on the viral infection. We have dealt with several viral infections in the past, whether it is influenza, whether it is a swine flu, whether it's a Middle Eastern virus, whether it was a SARS. Yes, we have had several epidemics. The influenza was a pandemic in the 80s. So yes, we have gone through several viral illnesses. Usually, for a lot of the viral illness, there is not an antiviral medication that's available readily, particularly when we first notice it. Think about the good old days when we had chickenpox. Often, and even today, the medications that we use are more for limiting the severity. It is not to completely treat the underlying chickenpox. So we, use medications, but we often use what is called supportive treatment. So we just make sure that if there is a fever, you treat them. If they have body ache, you treat them. So that is how most of the viral illnesses are often dealt with. In fact, in chickenpox, they often used to say it is better to get it in childhood, because if you get it at a later age, it can even be more severe, and therefore, it is better to get it at a younger age. Then we understood better that, like once somebody gets a chickenpox, they get immunity and often may not get a recurrence or a second time. But if they do get a recurrence, it may even take a different form. For example, the herpes zoster or the shingles, that we notice. So, this is something that we have taken years and years to understand. And as I said, even today, when we give a medication, it tries to reduce the severity of the illness. That's what we do. Think about the other ones. Influenza, common cold, like common influenza often is very mild. A lot of people may get fever, may get a cough, may get a sore throat, may get some, like congestion of the upper airway, or, they may feel like coughing some phlegm. But most of the times it could be self-limited, to the extent that we tell them, please don't take antibiotics when it's a viral illness, because the antibiotics are not for the viral illness. It is only if you are having a secondary, what we call bacterial infection, that you need to take it. Otherwise, just, like doing all this, drinking a lot of fluids, keeping yourself hydrated should take care of it. So this is how we were dealing with the common cold and the influenza. Then came some of these that took severe forms, and particularly, remember the SARS and remember the swine flu, where, we found that, what, suddenly this is taking a very severe form, and people are getting to need ventilator support, they're needing significant respiratory support, and therefore, like we started dealing with them a little differently, trying to identify them early, making sure that they get the support earlier than later, so that, the mortality could be reduced. Interestingly, every time we face these pandemics, they seem to take a little different form. Like the swine flu, the first time around when we had it, we found that there were a lot of young people. There were pregnant women, there were obese people who were getting the swine flu. The second time around, it was completely different. A lot of elderly people were, like getting it. So now we've started getting used to this swine flu, where we know that, okay, yeah, like if people get it, sometimes it could be mild. If it is severe, this is what we do. Again, no major antiviral drug that has been proven to be effective for swine flu. Okay. Now, why is this different? Why is this, COVID-19 different? Number one, it seems to be a lot more contagious than most other viral influenzas that we have seen. And therefore, the numbers are alarmingly high. So it is not only the treatment of the individual, but it's a huge public health problem, where we need to scale up quickly to deal with the large numbers of patients who are going to need support. So that is one thing that the healthcare has to work towards. The second thing is, the way it is behaving seems to be very different. There are people who have come looking normal, feeling normal, but after a period of time suddenly deteriorate, and then, they may develop some problem. There are others who, just come in, unfortunately, like deteriorate very, very rapidly, and it is extremely difficult to give them enough oxygenation, despite putting them on a ventilator, maximum amount of ventilatory support, maximum amount of oxygen, and they rapidly deteriorate. Now, I don't say this to make it alarming, but what I want to reinforce is the fact that it does seem that people who are older, people who have comorbidities, by that I mean, other chronic diseases, particularly those having, diabetes, or any kind of disease that could lower their immunity, like rheumatoid arthritis, or if they're on steroids for a long time, or if they have an underlying lung disease, or if they have a transplant before and taking what we call immunosuppressants, all of this seems to make them more vulnerable to severe disease, and they may rapidly deteriorate. Again, alarming figures, but internationally it has been found that, people who have severe COVID disease, who have gone on a ventilator, the outcome seems very, very poor. The mortalities have been as high as 75 to 80%. But having said that, now to the positive side, of all the people who have COVID disease, almost 80% of them get only mild disease. So please don't panic. Everybody doesn't get that. what we see is a very, very biased population. We are only seeing the sickest of the sickest. So I do not even want people in the community to think that everybody who gets is going to get severe disease. 80% of the people who have the problem continue to have mild disease, invariably just fever, sore throat, maybe some headache, body ache, and then they resolve with just taking some, like painkillers and do much, much better. So this is just in general, I wanted to talk about viral diseases and how this is different. Your other question was on our hand washing. Is that what you asked?
No, how the travails of the healthcare professionals and how they are managing and coping with the severe stress on themselves.
Okay, great. I'm glad you asked me this. This is unpublished data, but we have just done a survey amongst our own healthcare professionals. And you would be surprised that more than 50% are depressed or have some kind of anxiety. Moderate, but they all, more than 50% had at least moderate depression and moderate anxiety. So the psychological wellness seems to have taken a big toll. Particularly when a peer, a colleague falls sick, the morale goes down very, 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 low to a lot of people. Interestingly, what we found in this analysis is that younger people, particularly those who are either single or who are the primary breadwinners of the family, seem to have higher amount of depression and anxiety compared to even the older healthcare professionals who seem to have less of it. Women seem to have more than men, and that again may be a little biased because of all the healthcare professionals we interviewed. Several of them were nurses, so that could have been a factor. But what was important was that this amount of depression and anxiety was no different whether they were actually providing bedside care for COVID patients or not. Okay, so not everybody is in the COVID ICU. There are so many nurses taking care of patients in the regular ward. Even they seem to have this fear and anxiety. And that's something that's extremely common. So that's number one. The second thing that we are noticing is even a little bit of any kind of these symptoms, because they're seeing all these patients so sick, they seem to be worried. When they get, just body ache, then they get worried whether they could have COVID. So manpower planning is becoming a huge, huge issue because it's already difficult to get skilled manpower in healthcare consistently. Like particularly nurses, there's a huge turnover every 2 years. Nurses leave, particularly with Middle East and other countries opening up. Of course, right now that is something that is not happening, so we're able to retain them. But like retaining manpower, working out rosters to ensure that they feel that they're off sufficiently to get back into this, all that has been challenging. But having said all of that, if any of you come in and see how they are working once they are inside, it's amazing, absolutely amazing. Like they forget what it is, they do what they have to do, but then they probably have this inner anxiety, fear, which all manifests later on. And I would say that it has taken a significant toll, particularly on the psychological wellness, and also to some extent on the physical, but more on the psychological aspect.
Now that you've spoken about the healthcare professionals, fellows like us, the prospective patients or maybe not yet patients, hopefully, what are the things you see us doing wrong? What are the things we could be doing better?
All right, let me, since you said prospective patients, I can't let you go with that. But let me tell you, unfortunately, this is like common cold. If you haven't got it, you may get it. Okay, so don't panic on that mode. You may get it. All I can say is let's hope it's going to be mild and just goes away like a common cold. Let's hope that each one of us here, and everyone else belongs to that 80% and not the 20%. So that's the best we can hope for. But it is so rampant that everyone may get it. Like I sometimes feel that I may either have already got it or I may get it later. I don't know. So because we interact so much, and that's quite a possibility. So if you ask me, what are you doing right and what are you doing wrong? Once again, the preventive measures that have shown to help are number one, I would call it physical distancing. You don't want to socially distance from people. You want to physically distance yourself from people. That's exactly what you're doing. So physical distancing seems to help because, even talking or if they cough, any of those would definitely spread the aerosols, and if they have it, and that can be an issue. And you don't know when you're walking around, when you're talking to people, you don't know who has it. And therefore, it is good to be taking that precaution of maintaining the distance, particularly when you're going for a shopping and all that. I see all these boxes and circles marked in several of the retail stores and stuff. Please do follow that. That would make a tremendous difference. Number two is wearing a mask. I see two extremes. There are people who are going a little overboard, wearing masks all the time, even inside the house, when they are alone or, not necessary. You don't have to go to that extreme. But whenever there is a possibility of an exposure, it is good to wear a mask. And for the general public, I think wearing a cloth mask is reasonable. Okay, and I think that would be something that you can use. Inside the hospital, of course, we use, depending on whether we are going into an isolation patient, we may use what is called an N95 mask, or otherwise we use what is called a 3-ply mask. So it is a little different, but some kind of a mask that is appropriately covering the nose and the mouth is important. Now, why am I saying this? I do see some patients who insist on coming. We do a lot of teleconsultations, and I can talk about that later on. But sometimes I do see patients in the outpatient setting where, when they come in, we put them through all the, standard protocols. When they come in, their temperature is checked, they're asked to wash their hands, they're asked whether they have a mask, they're supposed to wear it. If they don't have one, we give them one. All of these are being done. And then they come into my room, and, we have separated the across the table, that there is sufficient distance, that they sit far away from me, all of those. And guess what they do? After they come in and sit, they will remove the mask. And when I ask them, why do you do this, they say, oh, you may not hear what I'm talking. Thank you. That's still okay for me. So I always tell them, it's perfectly fine. You can hear me, I can hear you, so please use the mask. So that is the other thing. So follow what has been widely being told about the social distancing / physical distancing norms, and using the mask when it's appropriate. And please try to avoid crowded spaces. And that is the reason all this, section 144, they don't want larger crowds, all that. But unfortunately, I don't see people following those things. I still see people, I hate to see this, I'm all for physical fitness. But when I see people running in the morning, when I go to work, 6 o'clock, 7 o'clock, without a mask, that absolutely I feel is not being responsible. I think, while you want to focus on your physical fitness, I think you're compromising for so many others and yourself.
Okay. Now, one of the things that I know you're allopathy and all that, but there's the Siddha school and there's Ayush and everything, and the big talk about this building of immunity. And the Tamil Nadu government is a big one for distributing Kabasura, Kudineer, etc. I know you're an allopath, and there is a natural bias against some of these things. But what about this concept of immunity and stuff like this Kabasura, Kudineer, etc., etc.? What's your take on it, doctor?
Sure. See, first of all, I don't have a bias. I do want to say that every system may have its own place. I just say that I don't know about it. My knowledge is limited to allopathy, and that doesn't undermine a Siddha or a Ayurveda or a homeopathy in any way. Okay. Having said that, I completely agree that we need to maintain good immunity, good nutrition. It's almost like we talk about the pillars of wellness, and basically like good sleep, good exercise, good nutrition, and good psychological or emotional wellness. All these are important for being healthy and well. So definitely whatever we can do in the form of natural ways to boost our immunity, eating good food, and as I said, regular exercise, all of those would make certainly a difference. None of this happens overnight. That's one thing I could say even about other forms of medicine. I'm talking about the non-allopathy. It may help build immunity over a period of time, but it doesn't happen overnight. Don't expect, if you have Kabasura Kudineer, next morning your immunity is better and that you're going to be perfectly fine and you're never going to get corona. Don't have that kind of a hope. But if you haven't done all these necessary things in a long while and now you want to make a start, yes, absolutely, like take whatever is recommended, naturopathy, whichever system you believe, and it's good. The one thing, and I'm not talking about now or about the wellness, but in general, the one thing I tell my patients who come to me is don't mix multiple systems of medicine when you're taking something internally. And the reason for that is, like an allopathic might say, oh, you know what, I think it is related to your Ayurvedic or a homeopathic. And you go to the Ayurvedic person, he may say that, no, no, it's your allopathic medicine that's causing the side effect. So it may be difficult because of our lack of knowledge of other system. Each one may lack a knowledge of the other system and may quote unquote blame for the side effects. So I would just say in the long-standing illnesses, for example, like a diabetes or like a hypertension, if you're saying I'm taking this and that, you don't know which is doing good and which is doing bad. So that's where I avoid. But today's situation, when it comes to just boosting the immunity, general wellness, sure, whatever works is fine.
Great. There are a couple of questions from the audience.
Sure.
One is I think a question that people like me are a little worried. They know A positive, A group is more prone to this, while O positive is less prone to this. Is that really a fact, or it's just nonsense?
See, you didn't ask me this question when I told you that when people with comorbidities are more prone. You didn't ask me whether that was nonsense, right? I mean, so why I'm bringing that up is as we understand the disease better, as the numbers are more, it's number crunching. I mean, you guys are better than me in that, so it's number crunching where you look at patterns of behaviors and you may find that, I mean, there are so many other things that have been associated with blood groups and malignancies, blood groups and other diseases. Yes, there may be pattern. How does it matter? You can't change your blood group right now, right? So you have to accept it. Even if it is, I don't think it's worth thinking every day, oh my God, I'm A positive. When am I going to get corona? And that's probably going to ruin you more than actually getting it sometime when it could just be mild. So yes, knowledge is good, but don't, be too concerned about these things. Yes, it may be a pattern that's observed. I told you when the first time the swine flu came, people who are obese and people who are pregnant. That doesn't mean every pregnant woman got it. It just means that the numbers were more amongst pregnant women. So that's how it is.
Just a more a pattern. Now, another question is things like vitamin C, D, zinc, etc.
Yeah.
Again, especially overseas, there's a belief that all this helps in improving your immunity and resistance to it. True?
Yeah. So, I mean, there's pros and cons. A lot of studies have looked at, using this long term, particularly for, building the immunity. And as it was rightly said, zinc helps in recovery, healing, same with vitamin C. People are taking cocktails of these. Okay. So again, nothing is without side effects. So I wouldn't take it lifelong. Like I'm a vegetarian and, a lot of vegetarians are often B12 deficient. I also get some leg cramps and I have some varicose veins. I'm just giving my own example. I have no problems in mentioning this. So I take some vitamin E, but I don't want to take this every day. So what I tend to do is I take either a month of vitamin B12, next month of vitamin E. So about 6 months a year, I would probably take both, or I would take it on alternate days. Why I'm bringing this up is excess of anything is not good either. Taking it for a period of time is absolutely fine, but nothing is free of side effect. Vitamin C is what we call a water-soluble vitamin. So you excrete it in urine if it is excess. But there are reports of people developing oxalate kidney stones with too much of vitamin C. So we just need to be careful. Good old grandma giving you lemon is vitamin C. Taking oranges, is vitamin C. So we can mix it in different forms. You don't necessarily need to load yourself with all these supplements, but taking it for a period of time is certainly not harmful. And if it helps, it's perfectly fine. A lot of people are either believers or non-believers in supplements. There are very few who are in between. There are some who love supplements. They just say it's good, fine. There are some who say I will never take it, fine. So it's just a matter of what you want.
One doctor I talked to said, the way of getting expensive urine. So, which was a little bit much, but it looks like it's the truth. But there's another thing, this thing about testing. There's a lot of controversy, and some people are very anxious to get themselves tested and all that. What's your take on this? Should I get myself tested when I show no symptoms? What really is your
Okay.
your professional
Right
view.
now,
Yeah.
what is recommended is, let's say that somebody has just a fever and a sore throat and, maybe some lack of smell, uh, nothing else, they're not feeling breathless, they're not feeling too tired, exhausted, they're able to eat reasonably well and can stay at home. Usually now in these kind of people, we just tell them, please stay at home. You don't even need to get tested. You quarantine yourself in a single room where nobody else comes in. Okay. Now that's the hard part. That's why I'm, specifying that a little bit more. We live in India where, a lot of people live in apartments, a lot of people are in much smaller, dwellings where they cannot isolate themselves. Then they end up going into the hospital, in which case they automatically start getting tested. But if you can be at home, there is no need to be testing for the mild illness. Okay. And you can just recover from it after about 10 to 14 days. Things are fine. You just go back. Even in the hospital, things are changing. Like earlier, when I say earlier in March, when people came in, they got tested. And after about 10 days, they got retested. And they needed to have 2 negative tests before they could be discharged home. Can you imagine the amount of resources, not only for the testing, but also they may remain in hospital for long. And we also started understanding the disease better, that there may be dead virus in your system, which is in the lung and thing. And some people remain positive much, much longer. There are people who are absolutely asymptomatic, have recovered, but they remain COVID positive. So that doesn't mean that you can keep them in a hospital or isolate them forever. So the thought now is that if you are having mild illness, particularly if you don't have breathlessness, you are not requiring any kind of oxygen. And if you have the facility and you can check what is called the pulse oximeter, basically checking your oxygen level, if it is maintaining over 93, 94%, you can stay at home. One of my very close friends, I'm managing that way at home. He keeps calling me every day and he's doing absolutely fine. Very educated person, has an independent room. He's able to do all of this. The family is able to support this and he can do it. If you can't do this, if you're not able to isolate, and if you have any concerns, or if you become breathless, and breathlessness seems to be the main thing that we keep, reinforcing over and over again, then you need to go into the hospital and you will get tested. Okay. Now, the second group is the contacts, people who have had COVID and then once again, previously, we're tracking all the contacts, checking everyone. It's not required to go and do COVID testing on everyone. Today, what we do is, once again, if they have symptoms, if they have concerns, then we may go test them. Otherwise, we don't. Now, people are sometimes unhappy that, oh, I'm not even able to get a COVID test. Okay. Please understand, if it is medically necessary and the doctor orders, it can be done. Yes, there may be some limited, I think in a day, Tamil Nadu is testing over 30,000, which is, in my opinion, reasonably good, because we, I think, are the largest testing state in the country. We have tested more than 1 million, and even none of the larger states have done that. So we are quite reasonable. And I think we are also reasonably transparent. And I'm going to be a little cautiously saying that in the numbers and all of that. So I think we need to accept that. Don't go and test everyone just because they have a cough, sore throat. It's not something to be happy or sad labeling yourself as corona positive or negative. Okay. I think that mindset needs to go. This is like anything else, like a woman can't go and get pregnancy test every day. Okay. And similarly, when you have a cold, you don't go and get a blood test every day. So I really don't think doing corona testing is going to make a difference. COVID testing will do a difference unless you have symptoms.
Okay, now there is talk of Bharat Biotech coming out of the vaccine. There are some of these drugs, and now the US has cornered all the supplies of remdesivir from Gilead Life Sciences. So where are we really, very quickly for the lay audience, with respect to potential cures like remdesivir or whatever, and B, with respect to a vaccine? Do you think really honestly a vaccine can come within less than 5 years, 2 years, etc.?
Okay. First, with regards to the medications that are available, as I said, we have been evolving on what seems to work. Current, like initially there was so much of, popularity or publicity for hydroxychloroquine. Then we just went completely back and said, hey, you know what, keep away from it, kind of a thing. Then something else came, like lopinavir, ritonavir. There were so many other medications. Today, if you ask me if there's one medication that has been proven to help, actually it is dexamethasone, which is steroids in patients who are sick, those who are requiring oxygen and higher, and those who are on a ventilator. There is a study called recovery study that has shown that people of that category seem to benefit when you give them the appropriate dose of steroid. Okay. The next one, and that is more, it is modulating your immunity. So it's a different style of working. Amongst the antiviral drugs, the one that has been shown to be of benefit is actually remdesivir. Again, not for everyone who is just having a cough or a sore throat. It's only when they are requiring oxygen or more. That is when we put them on remdesivir. And strangely enough, unlike steroids, here we find that once they become so sick to be on ventilator, it may not be that helpful. Whereas those who are on oxygen, what we call hypolonous, it seems to be helpful. So it's a knowledge in evolution. Today, if you ask me, these are two drugs that are shown to be of value. We are yet to be convinced about, Fapnovir, the new tablet that has come for mind. This is how, for convenience, I don't usually use trade names, but I'm telling you, Tamiflu is something that people have been very comfortable taking for, swine flu and other things. Once again, it has not been shown to clearly have antiviral effects, but it seems to limit the severity of the disease, and therefore people take it for 5 days. So with regards to stocks and stuff, I think the government has to keep working. And yes, there is also an Indian company that's coming up with remdesivir. Hopefully, we should be having stocks of those, and not that everything goes to America. That hopefully doesn't happen. Lastly, but not least, with regards to the vaccine is a process in evolution. I mean, people need to build immunity. Even if you take your vaccine today, it's not like tomorrow you are immune to developing COVID. So it is a process in evolution, but there seems to be some hope. From my gut feeling and the scientific feeling is that it will take at least till the end of the year or next year for us to have some reasonable vaccine that can be, in a way that's available. But it's not a cure-all. Please don't think that tomorrow when you get it, day after by the time we get the vaccine, we may not even have COVID, and people may not even want to take the vaccine unless there is a. See, I mean, how many adults are routinely taking influenza vaccine every year?
Correct.
Even those so it might become like that.
Now tell me, there's a lot of, suddenly I found a lot of people in my apartment complex and many other complexes buying this gadget called the Oximeter.
Yeah.
Okay. Now, is this really correct that once you touch below numbers like 95 or 93, you're in trouble? And, can we every day keep checking our the Oximeter? What's your opinion, doctor?
It's good to have it if it works. Okay. Why I'm saying that particularly is one of our own doctors, a critical care colleague, got a pulse oximeter. Okay. And it showed ridiculously low numbers. It said 70 or something. He said, there's no way, man. I'm breathing fine. I'm doing okay. And then he took it and kept it on the table, and it was still showing 70. Okay. Without even his finger being clasped to it. The way this works is, it is feeling, the pulse oximeter is going to, tell you what is the percentage of oxygen saturation. And yes, it needs to be over 93 to 94% when you're normal, breathing on room air, when you're walking and comfortable. So having one is fine, but not to the level of getting paranoid and obsessive about checking your oximetry every 10 minutes or every 1 hour. That's not the recommendation. But if you have corona or suspicion of a COVID, and you are isolating yourself and you want to decide on when to go into a hospital, certainly it's a useful way. Particularly, a lot of doctors now do teleconsultation. Nurses can look at you remotely, and if you tell them your parameters, it helps to decide whether you need to come into a hospital. Yes.
Okay. Now there are a lot of things like, which can I get newspapers at home? Should I wash the vegetables and fruits which I buy outside? What should I do with provision? Should I put Dettol solution or some other thing, and wash them? What really would you suggest very quickly to allay these fears?
I think the newspaper issue was sorted out before, it went to the extent where newspapers were wondering whether they should stop publishing. The question is, these fomites, whatever we are touching, how much can it transmit? I mean, Can there be, if somebody coughs into a newspaper, can the virus be there? Yeah, yes, it can be there. It can be there for some time. It can be a matter of, minutes to an hour that it can be there. Possible. The second thing is, how does it get carried in your hands? Okay. So that's the reason. If I go to buy a newspaper, obviously I would use a mask. I would get a newspaper. When I come back and leave the newspaper, I would wash my hands and then start reading the newspaper. That's absolutely fine. The risk of transmission on that is extremely low. With regards to washing vegetables, it's always a good thing to wash vegetables, not just now, but always. So washing it in just clean, pure running water, pure, I don't know, but clean running water is good enough. To go to an extreme of spraying stuff and all that is not required. But if that makes you feel more comfortable, it's fine. Certainly wouldn't use too much of chemicals to wash it. That's not a good idea in general. There are people who are a little bit more comfortable when they buy stuff, groceries and stuff, to leave it in sunlight for some time, which, as I said earlier, it may help to kill the virus, or like if it is there as a transmission through the fomite, it might help. So it can't hurt, but please don't use bleach and chemicals on top of it, because that might cause other kind of harms when you are consuming those kind of food. So keeping them in a dry place in sunlight is absolutely fine. Washing whatever you can wash in running water is fine, but beyond that, I don't think it is required.
Okay, now as a you are also an individual. You are also somebody who's worried about his health. How exactly are you personally managing your situation?
I think it's a very, very valid thing. We're all human beings, and we are worried about ourselves and our family. So what do I do? Number one, in my house, my wife and daughter have hardly left home since the lockdown. They've never left, like I think maybe once, but nothing other than, they don't even go shopping. They are inside the house. I am the only one who goes out, and I go out every day. I have to go to work, I come back. So I do all the grocery shopping. I do all the, like vegetable shopping, whatever is required, and I bring it and leave it. And as I said, it is washed with water. And yes, it is left for drying for some time if it is appropriate, whatever we get. When I go to work, I nowadays started wearing scrubs. I'm sure you've seen us all in scrubs. And then when I come back, leave my slippers outside, I walk in and go straight into the shower. And yes, I put my clothes in, a bucket with maybe Dettol or something like that, and leave it there to soak, have a shower, and only then come out and see or talk to any of my people. So that's the level of, care that I need to take. And if I go out for getting groceries, getting newspaper, I always use a mask. And, as I said, following social distancing, physical distancing norms when I'm outside, all those I follow, but nothing additionally. These are the common things that anybody should do, and that's what I do.
Okay, now I know there's some more questions, etc. Some of them are from a Dr. Sri Ganga, is a very technical question, so I'll probably bring it a little later. And there are questions about potassium permanganate, but you've answered all of those, so now, how is your sleep, doctor? I want to move to the next segment. So then I just want to ask you, how well do you sleep?
I sleep absolutely fine. Except one night, and I will tell you about that later on. In general, I am the kind who sleeps on time, wakes up on time. I cannot almost keep awake after 10:30, and I cannot almost stay in bed after 5:30 in the morning. So I'm one of those 7-hour sleepers, sometime between 10:30 to 5:30, and I continue to maintain that cycle. I do continue to do my morning walk, morning exercise. I go to my terrace, or I do some stretch exercises inside the house, or yoga, whatever I can do in the morning. So continue to do some activity. Little cautious about eating, because when you are more at home, you tend to consume more. So be a little extra cautious on that. But the good thing is, it's all home food now. We all are not going out. We are not ordering out. So that way, it is a lot more healthy. I do my share of the household work. I certainly do whatever it takes to wash the dishes or help with cooking and all of that. So it definitely helps me to maintain my routine as much as possible. And honestly, my routine hasn't changed too much, so I'm able to sleep. Whereas people whose routines have changed are having sleep problems.
Okay. Now, one of the things, my mantra, I very crude, I'm sorry to the audience in advance. It has been very simply GNS, GMS, okay, which is a good night's sleep and a good mornings. I don't want to say the second part of that word, okay. But basically, I believe that if you don't sleep well and you don't have morning ablutions very well, something is wrong. Would you say sleep is a symptom, or bad sleep is a symptom of something going wrong, or it is itself the cause?
Actually, it is chicken or egg first. Okay, honestly, it can be both. Sleep can be a symptom of your underlying problem, and I will give you this one example. I told you that there was an issue that happened where somebody walked in without personal protective equipment inside a ICU, and I had heard about it that day. And that night, I woke up with a dream saying that I was in a place without personal protective equipment. That woke me up. That was the night I told you I didn't sleep too well. Okay, so why I'm bringing this up is, yes, sleep problems can be a manifestation of something that's going on with you, whether it is physical problems or whether it is psychosocial problems. It can definitely impact the sleep. On the other hand, if you don't sleep well regularly, particularly if the sleep disorder becomes chronic, it can impact tremendously your physical health. People who don't sleep well are clearly shown to have reduced immunity to the extent they may not respond to vaccines. Okay. Yeah. So it has been
Okay.
chronic sleep deprivation has been shown to do that with some of the prior vaccines. It has also been shown to cause hypertension, to cause diabetes, to cause heart disease, stroke, a lot of hormonal changes. Like people, young women can have menstrual irregularities. Infertility has been more associated when there are chronic, sleep problems. So, and depression, anxiety. So there are a lot of issues that can happen without good night's sleep if it remains for a long time. Not having a sleep for one night doesn't do all of this. If it is persistent, it can be an issue.
Okay, what I've done is we've got a little poll for the audience, So Saurav, I'll just request you to put question 1 and let's see what the responses look like. The question really is, how often has poor sleep troubled you in the last month? So I'll just request you to.
Wow.
Okay, so you have very often and sometimes are almost, 70%. 65 to 70%. And very few have no
To explain
problems.
that once you are done with your poll.
Yeah.
So shall I share the report now? Share the.
Yes, please. But only 18 or 4. So okay, just put it. Okay. Only few of them have answered. Okay, good. Anyway, let's go with this. Is this mirroring what you're seeing in your practice, doctor?
Yes. Okay. So what we have noticed, and we are describing this, and hopefully we'll publish it. We're going to call this lockdown sleep syndrome. Okay? So what has been happening is whenever we ask people, even those who have not had previous sleep problems are now developing sleep problems. Okay? Those who have already had sleep problems are experiencing that it is worse now. Okay. So definitely the sleep problems have increased, and broadly this is due to a few reasons. Number one is reduced activity. Okay, their work schedule has changed. A lot of them are working from home. That of course, is a whole thing to talk about. Yeah, maintaining etiquette, how you do it, would make a huge difference. So the lifestyle has changed. So that is activity level. Number two is reduced sunlight exposure, because people are always inside a closed space, and not having enough sunlight can affect our body's ability to secrete melatonin in the night, and that can impact the sleep. So that is the second most common reason that we are finding. Then the third one is fear and anxiety about the disease, about COVID, on, will they get it? Somebody known to them got it, how they, responded or, succumbed to it or whatever. All those fear about the disease seems to be the third most common reason. And number 4 is fear and anxiety and uncertainty in general about the future. And I'm talking to a group of entrepreneurs who all probably face this. How are we going to cope with this? How do we? So these are the 4 top reasons that we are finding where people are experiencing. It may be a combination of these. I'm not saying it has to be one or the other. It's a mix and match of all of these. But pretty much all our patients, when they're having either new problem or worsening of pre-existing sleep problem, we are finding that they will have one or more of these 4 factors.
Okay. Do you think, that, what is it that people like us can do? There is anxiety, especially for entrepreneurs who are already having uncertainty. The levels of uncertainty have gone up manifold. What is it that we can consciously do to mitigate this anxiety and therefore ensure good quality of sleep?
Few things in general. Number 1, trying to mimic your schedule as best as you can, even while at home. Okay, having dedicated work hours if you're working from home. Having some regular morning walk, exercise. If you can go to the terrace, please do it. If you're in an apartment and just want to walk, in the stilt area around it, that's fine. Of course, ensure that you're wearing a mask. Of course, ensure that you're maintaining physical distancing, all of those. And then doing some yoga, breathing exercises, stretch exercises. Some way of doing physical activity is an absolute essential. Okay. Number 2, if you are working from home, I always tell people, if possible, and again, I can say this, some of it may not be practical. If you can have a dedicated workspace and you are not, mixing family and this, and you're just going to be in your space working, and then you only take like fixed breaks, you might come out for a coffee, tea, or you may use the, just like how you would at work, have at lunchtime and then go back. Why I'm even mentioning this is, while the productivity might have gone up for some people, a lot of them do slack when they are working from home, in the sense they take an afternoon nap, which affects their nighttime sleep. They watch some video or news or any of those, in between. So that seems to make them even more anxious, worried about, today is 3,892, yesterday was 2,004. How does it matter? Honestly, it does not. Okay, so I've stopped watching news on that. So it definitely is something that we can do when it comes to work. And then once you come out of work and you're having family time, now you don't have the option of going out and dining, or going out for a movie or any of those. So try to see what you can do at home to unwind. Make something interesting. Who knows? Again, this might sound like an upper middle class syndrome, but you want to have a nice dinner, sit down dinner, you want to have a candlelight dinner, it doesn't matter. You want to do something exciting, please do it at home. Something to unwind, something to relax. Watch, watch a movie, or listening to music, reading books, any of those, if it interests you. Again, each one should have their own interest that could help them to unwind. Is absolutely essential. Avoiding screen time very late in the night, because now people are working from home and they're always on the phone, or always on a tablet or a computer or something late in the night. All of those should best be avoided. Okay? And as I said, with regards to reducing anxiety, the one thing I would strongly recommend is, we cannot fix the COVID numbers. Okay, so worrying about those, unnecessarily by looking at media, repeatedly, and not thinking of anything other than that itself is a huge source of anxiety. I think you need to consciously withdraw yourself from that and start thinking about other things, see how you can get a little bit more involved. That itself would make a difference. With regards to, the work uncertainties, you mentioned about entrepreneurship. There's always an opportunity in every crisis. Like in our own example, I will tell you, you mentioned about me. We have the Chennai Critical Care Consultants Group, where we are providing, bedside care for the intensive care, ICUs across Chennai. So that part is extremely busy. So that company is doing fine. Okay. Whereas we also have TACT, which is the training academy. Now training is zero. What we do is we train people on life support. We train people on, ventilation. How do you manage emergencies, trauma, and all of that. But what we have found, and in that, like we have tried to start making some of those courses online, which we never thought about before. We are trying to do some hybrid courses, interactive online. We've also got some large contracts where, like now the government in whichever schemes is buying ventilators and giving to people who may not know how to use it. So we've got contracts on training them remotely on how to use the ventilator. Okay. So yes, it is nowhere near what we used to do as far as the number, but still it is something and it keeps us going. Same thing with Nitra, our sleep center. We used to do several sleep studies, which are all restricted now because, we can't go home and do it, they may have, and, like we used to do a lot more consultations. We used to do a lot of, the CPAP, trials, treatments, all of those. All this has come down significantly, but we have tremendously multiplied the number of teleconsultations we do, which I'm sometimes doing from home, or sometimes they may go to the office. The office staff have, reduce the number of times they have to come in. So I think we need to think about opportunities that can evolve out of this. It may not be perfect. It may not be where we were, but who knows? It may even be better than what we were. So that's how we.
So if I were to just summarize what you said, because a whole lot of things you said is try to maintain a steady, consistent routine. We have a certain kind of discipline, especially with respect to eating, screen time, napping in the afternoon, etc. Number 3, try to carve out some specific time for family time or for some specific interests like reading, music, etc. And number 4 is try to find out creative ways in which you can manage your anxiety, especially with respect to your business.
Absolutely.
Basically. Now, I'm very happy to share that one of our members, Revati Kannan, says that she tries to keep doing something creative ever since March. And she's also given a specific site where others could possibly join. Thank you, Revati. And Anant has given a very interesting phenomenon. He says that Netflix syndrome is the most common reason for sleep deprivation. And some people do want your contact, so we might share your email ID or your Nitra Institute of Sleep Sciences contact little later.
Absolutely.
That should take care of Vardarajan. Now I'm just going to do question 2, which is the type of sleep. Okay. Mm-hmm. And Saurav, can you just ask, put up the second question? How often have the following problems occurred in the last month? Not able to sleep, getting up in the middle of the night, waking up too early, feeling drained and exhausted in the morning, and none of the above. We'll just give about 10-15 seconds and oh, you put your contacts. Very nice of you, Doctor.
My number, just for information. It is my Nitra manager's number, but she can connect.
Okay, I think we have a few responses. So, Doc, getting up in the middle of the night
seems to be the most common thing.
Along with feeling drained and exhausted. Now, this seems to be there for quite a few people, this feeling of being, despite having what you think is a full night's sleep, if roughly 30% are feeling drained and exhausted in the morning, what is the reason and what do you think we can do about it?
Okay. Number 1 is we have to remember that it is not just the quantity of sleep, but it's also the quality of sleep that's essential. There are different stages of sleep. I don't want to get into all those details, but you need to have the right proportion of different stages of sleep. You need to get into deep sleep, and that's what really helps you to feel fresh. So quantity and quality make a difference. The quality, as I said, may be affected for people, particularly when there's no sunlight. If they're not getting enough melatonin, then their quality of sleep may not be good. So that is one thing. Okay. The second most common reason for not feeling fresh in the morning is if there is something happening during your sleep. And common example is snoring. People who are snoring have a condition called sleep apnea where their oxygen level comes down. They may not wake up feeling fresh. Okay. Now, you may wonder, why should it happen now? Okay. Again, like if you don't eat healthy, if you're gaining weight, snoring can be worse. So, it's something to watch out for. If somebody who's not feeling fresh is noted to be snoring, or, like having a dry mouth, waking up in the night several times to use the bathroom, then it is important to make sure that you're checked to find out if you have sleep apnea. Another important reason why people wake up in the night is if they have chronic underlying disorders that are not under good control. Typical example is, like diabetes. If your sugar is not under control, you may wake up several times to use the bathroom. Men, as we get older, can have prostate problems that wakes us up. You want to empty your bladder. So that's another thing. So unfortunately, during this period, a lot of people are ignoring the management of their chronic diseases, like hypertension, diabetes. They don't go to a doctor. Maybe doctors are unavailable. That's a whole thing. But definitely, like ensuring that you also take care of your chronic underlying disease is extremely, extremely important. So to answer your question, if you don't wake up fresh, think whether you're getting enough quantity of sleep. Think whether whether your quality might be good, or if there is any issue. Particularly, I've told you what all we can do to improve the quality of sleep in general. And then if you are snoring, it may need evaluation, something to think about.
Okay, there's a gentleman called Jawahar who has one or two questions. So I'm going to unmute him and he's going to ask his questions. Go ahead, Jawahar.
Thank you, sir. Thank you for the opportunity. Can you hear me, sir? Am I
Yes.
audible?
Yes.
Yes, please.
Thank you, doctor. A lot of good insights into both corona and sleep disorders. So, first I have a few questions that I would like to ask regarding corona. One is regarding blood transmission, because Tamil Nadu is notorious for transmitting blood, that is infected with HIV and things like that. So I'm wondering if at all, if I have to have a blood transfusion in cases like an accident or something, how careful should I be in taking blood donation from someone? What kind of test should I do to make sure there is no corona in that blood? That is my first question, doctor.
And we will go question by question. Doctor, you can answer this one first.
Sure. First of all, I don't know if I completely agree with you on the fact that Tamil Nadu is notorious for this. It may have happened, the press would talk about the one blood transfusion where there was a transmission, will not talk about the 1 million transfusions that are not transmitting anything else. Okay? Okay. I've heard the Home Minister say that no news is good news on January 26th. It is the same way here. Like you don't hear about all the transfusion, you only hear about the one that, transfuse some. Now, having said that, I think most blood banks, most good blood banks would have enough, like filters and making sure it is checked before a donor is, bled or it is given to the next, the recipient. So I don't think you should carry that fear too much in general. I'm not talking about the COVID. I'm talking in general. A good blood bank, if you need it, you need it. And at that time, that's what you need. With regards to COVID transmission in blood, as of now, there are no reports, which is all I can say. That things are evolving. Right now, there's nothing else. There is no testing to do. There is no antibodies to do or anything like that right now to see whether there is COVID positivity. On another hand, now we are looking for plasma donors. That is something that's becoming, you must have heard on TV and a lot of the media. People who are recovering from COVID infections after 28 days, if they now check COVID negative twice, they can be potential plasma donors. So the convalescent plasma seems to help in probably a select group of patients who are on oxygen, who are on BiPAP and all that. It's still, some people call it a trial, but the DCGI, the government has now approved off-label use of convalescent plasma. So there are policies, there are protocols. You have to test COVID negative. It has to be 28 days. All those are there. That's about all we know right now as far as COVID donors. I'm talking about COVID donors. The recipients are only going to receive the plasma of this. Plasma is just the water component of it, not the cells. They don't get the red blood cells or the white blood cells or the platelets. They only get the fluid in which all these cells are floating. So that's the plasma component that they are receiving. Long answer, but in short, blood is usually checked several times and should be safe for taking. As of today, we don't have a way of testing whether it is, carrying coronavirus, but there is no reported transmission through blood.
Okay, Jawahar, your next question.
Yeah, thank you, sir. So in regards to this, doctor, like the follow-up question is, say if there is asymptomatic corona patient today, he doesn't know that he has a corona, but so he goes to the blood bank, gives the blood, and say in another 2 or 3 days, I need blood, and then that blood is transfused into my body. So in between these 3 days, is there any checks in the blood bank they do to make sure that person, the asymptomatic patient, he gave the blood, right? So do they do any checks for corona?
No, right now I don't think it is done. I can check with the blood bank again, but I don't think it is done.
Okay.
Okay.
And
so, yeah.
doctor,
Any other question or no, we just have about 15-20 minutes left. I just want to ask doctor about some questions with respect to the state of the healthcare industry. So
yeah,
if
go
you
ahead.
have, okay,
Just
thanks,
one more
Jawahar.
question, maybe just
Go ahead.
one more question.
Go ahead,
Doctor, is it is it true that people who use common restrooms, they get corona? Is corona can be transmitted through restrooms, toilets?
See, I'll be honest with you. I don't know the accurate answer to this, but there was some concerns, particularly in the US, when they were using public toilets. They were wondering whether it was transmitted there. I've not heard that here significantly, but like if there are multiple people who have coughed and you're just sitting there, that may be one source of transmission, but nothing other than that. I mean, like particularly in a male toilet, multiple people standing, if somebody is coughing, it is more through the aerosol. It is not through the urine, or it is not through, any other fomite, hopefully.
Is that, I'm saying jocularly speaking, doctor, is that because in India we treat the whole open space as a big open toilet?
Hopefully not anymore, but yes, that's true.
Okay, now, I am now going to ask you some questions, both as an entrepreneur and as a healthcare professional. As an entrepreneur in the healthcare industry, what is keeping you awake at night?
If there is one healthcare emergency that has very much negatively impacted healthcare, it is this one. A lot of the times when some emergency comes, whether it's a mass disaster or anything, it's just increasing patients, dealing with them, that's different. Here we have a situation where there is one particular group of patients that are coming in, but that number has to be limited. Each hospital may have a limitation on how many of those they can take. As I told you, it requires a certain change in infrastructure and all of that. They may not be able to do all of that. And the number of other patients, I mean, there is no more wellness checks. Nobody is coming for routine wellness checks. There is no more, routine outpatients. Doctors are not doing surgeries. Dentists have zero practice. Okay? There are some specific, groups of specialists like ENT, all of them where, the number of patients has drastically come down. People are postponing elective surgery. For example, even something as simple as a cataract, people would be postponing surgery. So it has taken a huge toll on healthcare in general. Healthcare is going to take a long time to recover from this. Making changes to scale up on certain things while fully understanding that the income or the revenue is going to be nowhere near what it used to be earlier. There are so many smaller hospitals that are shutting down. They may never restart. We talk about restaurants and others. Trust me, in that list are a lot of small clinics and hospitals, small hospitals, nursing homes. They're all going to close. I've heard some doctors express severe concern on the fact when we talk about MSMEs not having income and all that. There are so many doctors without income right now because they're not seeing any patients. We're all, in a way, glorified daily laborers. We are not getting monthly fixed income. A lot depends on patients we see and income generated from that. So there are so many doctors whom I know who are going through depression, who are going through sleepless nights. And that keeps awake not just me, but several people in healthcare. Can't hear you.
No, I muted myself so that there is no disturb. Now, you said that teleconsultations have jumped. Patients today are comfortable doing something like this, and people are also very comfortable doing online payments. So, in a way, do you think that the future of the healthcare industry is going to change very dramatically, as it is in many other close contact businesses?
Yeah, see, I think digital transformation is happening in a lot of things, and healthcare is no exception. And there are some specialties that have lent itself beautifully to newer technologies. Like, I mean, ICU is a very technology-intense place, which we have already. When we have been providing tele ICU services for America from here for the past 10 years. I manage patients in ICU in America perfectly comfortably from here. And we've been doing that for the past 10 years. So yes, technology is increasingly being used, but I must say, and I must in fact thank the government, the ministry, to at a very, very appropriate time release the new telehealth guidelines. Okay? So in March, when this disaster was happening or beginning to happen, the government, the Ministry of Health released the new revised telehealth guidelines. Before that, there were some states which were completely banning. They said you can't do a telephone consultation, you cannot do a WhatsApp consultation, you cannot. I mean, Karnataka, for one state, had very clear rules saying you cannot do that and it is not legal. Okay. With the new telehealth guidelines, they have made it possible for any specialty where you can do and talk to them. It may even help with triaging. You all had so many questions about when do I go to a hospital, what should I do, I have a cough here. For that, I don't need to examine you. But if I can see you on video and talk to you and say, are you having trouble breathing? Can you check your temperature and tell me? And now there are remote ways of checking temperatures and all that. So, like there are, technology can be incorporated whereby we can see the patient. Another big, big change that has really helped from this is there are ways of sending prescriptions electronically. Okay, now the government has approved that if I have written my prescription on an appropriate letterhead, it reflects my registration number, I can send the prescription by WhatsApp, okay, which is extremely good because I cannot use the same telehealth technology that America uses. What do Indians have? A lot of them have smartphones. Okay, so this is a much better. They may not even have email accounts, but they have WhatsApps. So it definitely has eased, and it is the way forward. It may not lend itself too well to all specialities. There are some where you have to examine the patient, neurologically, or their lungs, their heart sound. Again, there are remote stethoscopes, all that are coming in. It will take some more time for those adaptations, but a specialty like sleep medicine lends itself beautifully. Dermatology, like psychiatry, counseling, all of those can certainly be done. So I think it's been a great boon that the telehealth guidelines were released.
Now, there are a couple of questions, especially Anto SR is very concerned that hospitals are getting overwhelmed, the healthcare system is getting overwhelmed, and therefore, what is your take on what improvements in healthcare infrastructure? Is this a wake-up call for India's healthcare infrastructure, and what key changes need to be made there?
I think the number one thing that we need to understand is we need to, in a way, create standardization and categorize the level of care that can be provided in hospitals. Now, every hospital doesn't need a cardiologist. Every hospital doesn't need an ICU. Every hospital doesn't need a cath lab or a CT scan or whatever. But we need to have tiered level of care and transferring patients between specialties as required. For example, in our own ICU at Apollo, I would pride myself that we are a tertiary and quaternary care level of ICU. We get a lot of patients who are transferred from other ICUs who cannot be managed there or too sick to be managed. That's how we get. Okay. So a hospital like this should continue to do that, because we have the manpower that can handle it. If you overload a small nursing home with 12 COVID patients on a ventilator, there may be one doctor who cannot manage them. So I think categorizing the facilities, calling them level 1 care, level 2 care, level whatever, some level of demarcation, and moving the patients to varied levels of care is absolutely important. Number two, is when you want to scale up, understand the needs. Even today, as I told you, 80% of the people have mild infections. They don't need to come into a tertiary facility that has an ICU. If they're all positive, they could be cohorted in a place, which is what the government facilities are doing right now, because that is what is practical and feasible for us. So doing that for large scale, mass scale, because the so-called home quarantine, home isolation may not be possible for people who are living in small dwellings or don't have homes. So bringing them to the right level of facility would make a difference. Insurance coverage is something that's absolutely important. I'm glad that there was some recent IRDA statements that, every insurance company has to come up with a COVID specific policy for 6 months period. And, they have set an upper limit, lower limit, and that there would be no pre-existing clauses in that for the 6 months, which is great news, because unfortunately, even in a private hospital where I work, the number of insured people is probably 30 to 40%. The rest are all paying out of pocket, which is not a practical thing right now in India. I think more and more people need to be aware of that. Yes, there is all this government scheme and all that that's coming. People who are eligible need to enroll for that. Those who are not eligible need to take appropriate coverage. Don't think, I wouldn't need this. This is one kind of coverage that I think everybody should have. I'm not really talking about COVID, I'm talking health coverage in general. But definitely during this situation, when even youngsters are getting the disease, I think everybody should get appropriate coverage.
Okay. Now, there are, in some, there have been a difference in how laws have been enforced in different parts of India. Like Kerala, for example, or Assam, the Northeast states have been a little more strict with wearing a mask. Now, Maharashtra has put a fine of 1,000 rupees if you don't wear a mask. Tamil Nadu, fellows like us in Chennai have seen public markets, whether it is Coimbatore or Tiruvanmiyur or Kashmir, people going very happily without mask. Now, what do you think needs to be done in order to bring about this culture of hygiene, cleanliness, etc. at an individual level? Is law enforcement the way? And is that the only way that we can really do it, Lee Kuan Yew style in Singapore?
While I completely agree that we need to enforce all this strictly, I also feel that the grass is greener on the other side. We think about Northeast implementing this. Only when we go there we understand the ground reality. There may be issues everywhere. There's no question. The number is different. Culturally, we may be different. There's no question about it. I honestly, even within southern states, I would find a lot of difference between Bangalore versus Chennai versus Kerala. The way it is enforced may be very, very different. The mindset is very, very different. The kind of government they have, what kind of expectations they have. Kerala is very different that way compared to what Tamil Nadu is. So no question about cultural aspects, but I think we need to get stringent with implementing the laws, and I think they're trying. But unfortunately, despite all of that, I don't know whether penal action is always the answer. I live in Anna Nagar, and I can tell you, when you enter the Anna Nagar arch, there are about 500 motorcycles parked there because they've all been seized by the police for people who are driving around unnecessarily. Somewhere near Roundtana to Chindamani, I see 200 cars that have been seized, that have all been parked. And they've all been told that after the lockdown, you can come and pick it up. But why do people behave that way, that this has to even happen? And yes, there is penal action, but how has it changed? You still see people walking around, with or without mask, running, the morning walkers, with due regards to physical health, need to be considerate. I think that's something that I'm noticing a lot, and that's the reason I'm mentioning it.
Okay, I asked the group again if there are any questions. Please feel free to raise your hand and we'll unmute you. Otherwise, I think again, Mr. Jawahar has a question, so we're going to unmute him.
Okay.
Go
Thanks.
ahead, Mr. Jawahar.
Yeah, thank you, sir, for giving me another opportunity. Sir, just a couple of more questions I had to ask you. One is it possible that the corona can be transmitted through mosquitoes? Any studies relating, because malaria is usually transmitted by mosquitoes. So that's why I'm
Malaria and
asking.
dengue have been known to be transmitted. This one, we are not aware of anything yet, See, and if you think about it, malaria and dengue are all happening more in places where mosquitoes are present, like more in Africa, more in India. Now, this is a, real pandemic that has affected the globe, where a lot of places don't even have mosquitoes. Okay. So, yeah, I mean, is it possible? We don't know, but as of now, there's no report of transmission through mosquitoes.
Okay, sir. And other question I had was, is it possible that a person who got corona and he got cured, and can he get it back again? Is it possible?
I mentioned this in an indirect way earlier when I talked about different viral illnesses, like about chicken pox and how it evolves. When somebody gets chicken pox, they either may not get it again at all because they've developed enough immunity, or they may get it in a different form. As of now, we don't know how COVID is going to be. It's in a way a new disease. We are just knowing what it is. I know of a couple of people who have recovered from COVID completely and have got it a second time. I do know some. Okay. So is it possible that they can get it? Yes. Okay. I don't know whether the immunity is complete. Will it take a different form? I don't know. Actually, this person I know has completely recovered both times. He's a doctor. Okay. But he's recovered completely both times. So it can theoretically happen. We don't know the disease enough for me to make clear statements on that.
Okay. Thanks a lot, doctor. Thank you.
Now there is one question which came from Dr. Sriganga about this virus coming through sewage and transmission through sewage. Is that really true?
Not that I'm aware of. I mean, this is something that it was brought up in an indirect way by someone else on, sharing common toilets and stuff. Not that I'm aware of. Is Dr. Sriganga a medical doctor? If she wants to share, I'm happy to.
Wait a minute. I'm going to try and unmute her. Wait, how do I unmute her? Okay, there we go. Okay.
Hello.
Okay. Go
Can
ahead.
you hear me?
Sriganga.
Yeah,
yes.
Can hear you.
I'm Dr. Sriganga. I'm a consultant geriatrician. And unfortunately, the sewage query was not mine. I have a more technical query.
Sorry.
No worries. I have a more technical. In the community, we do see quite a lot of patients who seem to be showing symptoms suggestive of COVID. So we've done a CT scan, which is comes back as Corad 5 or 6, but they're swab negative. And when it comes to hospitalizations, if they are unwell, there's so much confusion in the government institutions as to where they are placed, because we've had patients being refused saying the swab is negative, you got to go to Roypeta. But are there any clear guidelines as to about the swab negative COVID patients?
Okay. Couple of things. One, CT scan can sometimes precede your COVID positivity. That's one thing we are noticing. Like CT scan changes may occur even before they turn COVID positive. Sometimes there may be a lag of 4 or 5 days before somebody turns COVID positive. If you're strongly suspecting, then it may be better to do the test after about 4 or 5 days. But again, just having ground glass opacities in CT scan, or like having a fever or COVID positivity does not mean that they need to be admitted. Okay? If they are symptomatic, if they are hypoxic, that is when you need to admit them. Otherwise,
no, these are hypoxic patients. Yeah.
Finish. Okay, go ahead.
Sure. No, these are only hypoxic patients we have been talking about.
Then you need to be admitted.
Yeah,
but each hospital has their own limitations, what we can. I might tell even in our emergency room, this patient needs admission, but I don't have a bed. It is possible. So that's a whole different story on how we are going to, scale up to have adequate beds. But it's a real issue. We are sometimes sending patients out from our emergency room saying there's no beds. We have several other beds that are empty, but I cannot take a COVID patient in that.
Thank you.
Okay, we have come to, the time is about 6:27, and we had asked doctor for time between 5 to 6:30. I think we've taken a lot of his time. So I'm sorry we can't be physically present, and there's no way I can virtually give you a memento, doctor. So thank you very much for this 1.5 hours of your time and walking us through the life in the ICU, in critical care, and what to do about improved sleep and the state of the healthcare industry, plus your own personal experiences. With this, on behalf of Thai Chennai and all the audience participants here, thank you very much. Really appreciate your sharing your time and expertise and knowledge with us.
Thank you very much. It was a real pleasure.
Thank you, everybody, for being here. Good night, and have a good, stay safe and sound.
Have a good night's sleep. Yeah.
Thank you, Saurabh.
Yes, sir. Thank you. I'll be ending the chat.
Yes, please.